Hi, I'm Charlotte Jensen. I'm an animal-assisted speech therapist, and I want to take a moment to explain a very important concept that I have found to be very challenging, both for myself as the clinician, but also for my therapy dogs, and that is supporting clients who have approach-avoidant behavior. Before we begin, I want to give a big thanks to the families that allowed me to use these videos and photographs to help educate others about the joys and challenges that therapy dogs can bring to our practice. So when I'm talking about approach avoidant behavior, I want to make it clear that this isn't a true fear or phobia on the child's part. If the child truly had a fear or phobia of dogs, then animal assisted therapy would not be a good fit for them. You would need to either refer them to someplace else or schedule them at a time that you don't have your therapy dog with you, because the last thing we want to do is bring undue anxiety onto a child's life. But there are certainly a lot of kids. I see this especially with kids that have an autism diagnosis or some other sensory processing differences where they might be really interested in the dog. They might even run towards the dog in excitement, but then kind of at the last minute, they get a little bit overwhelmed, a little bit unsure how to react, and they might, back away or pull away or become dysregulated in some other way. And so that's what I'm referring to as approach avoidant behavior. So they want to interact with the dog. They get overwhelmed easily and aren't quite sure how to do that in a calm manner. So this can be really stressful for the client. Obviously, it is, inducing some anxiety. You might see this not only with therapy dogs, but with certain materials that you use or certain activities that you engage in. The child can just become overwhelmed. Their sensory system can become overwhelmed very easily. I find this is definitely the most stressful thing that my therapy dogs encounter at work. They really don't seem to understand if somebody is acting very friendly towards them one second and then all of a sudden pulling away or, trying to get away from them the next second. And so, therapy dogs by their nature have that affiliative drive to interact with people. And so if somebody's, jerking away, especially at the last second, it can be very confusing for them. So we'll get to see a little bit here in the videos of how my dog Delta responds to that and what I do to help support her through that as well. And then for the clinician, for myself as well, this can be challenging because it can be unpredictable. Obviously, I need to really make sure that everybody is staying safe and that the client is treating the dog in a fair way that's going to ensure their welfare and keep them happy and calm. And also that the client is being able to engage in therapy in a way that's going to be beneficial for them. So it can be a lot of things to juggle at once. So I'm going to show you a video of this little boy. This is a child that I think had kind of all three reasons for being approach avoidant with Delta. One, he really didn't have much experience with dogs in real life, is very, very interested in animals of all kinds, loves animal facts, really wants to engage with animals, but didn't have a companion animal at home. So he just didn't have a lot of experience. He had some negative interactions with a neighbor's dog who had chased him actually quite recently before he started seeing me. Whether that was an aggressive thing or whether the dog was just playing, it's hard to say, but he certainly attributed that to the dog being mean and vicious. And then he does have those sensory processing differences as well, where sights and sounds and certain textures and feelings can be, too much for his system very easily, and he becomes overwhelmed. So in this video, this is about 6 sessions in working with him. Did very slowly work up to this. The first session, just for everybody's comfort, I kept Delta out of the room. She was in my inner office with some special treats to keep her busy while I was getting to know him. And then we worked up to where he was going in and peeking through the window. Again, he was very interested in her. It wasn't that he didn't want her there or didn't want to have any interaction with her. He just wasn't quite sure what she was going to do and was worried that she was going to move too quickly. And so we worked up to him going and peeking through the window and looking at her, to her, being in a sit stay and him looking at her and talking to her. He loved to talk to her from the beginning. Finally, we got to where, he was in the room and she was just on the other side of the baby gate. And every session, this was just kind of a few minutes of our session, and then we'd move on to some other activities. So it wasn't like I took 6 sessions of just focusing on getting him used to the dog. That probably wouldn't have been the best use of our time therapeutically. But in this session, about 6 sessions in, he is starting out. You'll see him. It's a little bit hard to see because Delta's body is in the way, but he's practiced some dog etiquette with a large stuffed dog that I have, this weighted stuffed dog that I love to use for lots of different things. And so he's demonstrating to Delta, it's the first time that she's in the room right next to him, how he's going to pet her from shoulders to tail. So watch for how I'm giving him those really explicit instructions for how to pet her. Just, again, he's done this before with the stuffed dogs, but I'm just kind of doing that broken record approach to remind him of what he needs to do. Look for what words and phrases I model to describe Delta and her actions. Since he does not have a lot of experience with dogs, you'll see in this video and some later ones how he kind of misinterprets some of her actions very easily because he just doesn't know what she's doing. And then you'll see I end up moving this a little bit here so that they have more space. I want to make sure that everybody has a chance to move away from each other. I want to make sure that nobody's feeling trapped. And then also how I check in with Delta through some touch, eye contact, praise. I'm making sure that she's staying comfortable, because if she's comfortable, then she's going to be safer in this interaction, which is always highly important. And also, I don't want to unduly stress her to where she might want to not come to work with me in the future. So we'll look at this little video clip.
How we were petting the stuffed dog. Like shoulders to tail. Shoulders to tail. Soft head. Soft head. You can come over here and pet her shoulders. She's just looking at you. I'm going to move her back here so she's not quite so squished. Good girl, Delta. And I'll give her a treat while you pet. Shoulders to tail. Shoulders to tail. Shoulders to tail. I like how you were doing.
So you can see he was like, stop her head, because he wasn't sure why she was moving her head. I think in his mind, she was just supposed to sit there like a statue, and that's just not what dogs do. I'm going to show you another video that continues from the same session with Shreyan, and you'll get to see some of Delta's appeasement signals. So these are some dog body language cues that they are feeling a little bit stressed in the situation. They're cues that the dog's giving to try to let you know, to communicate to you. So you want to make sure that you're watching those and responding to those. I should note in this next video, you'll see that the boy is sitting right directly behind Delta. And I think that was a little extra stressful for her because she wasn't sure. That's pretty unusual. Usually kids are sitting next to her or right in front of her. And so she was a little extra unsure. So you might notice her looking away, just again, like breaking eye contact, essentially, like I'm not sure what to do, pulling her ears back. You'll see kind of right at the base of her ears, you get some wrinkles back there, some wide eyes. And then you might even see her flick her tongue out for a little nose lick too. And these, again, are all signs of minor stress that I need to deal with as part of my animal-assisted therapy session.
Why don't you come sit over here? Oh, you sit there and pet her? She wants to shake hands. Shake hands. You don't have
so you
to
can
shake
see her eyes are a little wide.
She says, who is that tickling me? Our shoulders to tail. Okay, what was our first question for Delta? Have you ever seen a dolphin? Bumpy. Her back is bumpy. That's her spine. She scooted back. She said that feels so good. Okay, Delta, scoot forward. Okay, what were our other questions for Delta? What are your dog friends? Oh, she had Bodie and Jill and Johnny. It's soft. It is soft. Fluffy. Good girl, Delta. Good job, Shreyan. Now we go. Can you see how the hair goes in a line like this? We pet with the hair. She's just lifting up her hand. She says, oh, that feels good. Can take a picture of Delta? Yeah. We take off hair. Yeah. Some of her hair shedding. You want to shake her? Would you like to shake her? So her paws are a little rough. Shake. We should give her a treat for that. You want to help me? Put your hand underneath mine. I will just. We'll do the hand plate. Do you want me to put my hand with yours? And slobbery. Do you remember about demanding versus asking? And taking it away? Or grabbing things? Do you want to demand Delta lay down? Or do you want to ask her? Can you please lay down? Oh, nice asking. Delta. Oh, she erased some of our questions. Tries to eat. So, yeah, remember, we're not just going to grab her foot, but we can ask her. Can I please grab your foot and shake it? Can we shake? Can we shake your hand? Shake hands, Delta? We shake, okay. Shake. That's a bumpy day. Is it a bumpy foot? Yes. Bumpy foot? Those are the bones in her feet. Good girl, Delta. Thing on our list today, though. Hey, Delta. Yeah, one more time we'll do Pop the Pig. You know what? We need to be all done with Pop the Pig today. Yep, Camille, go. You know what? Wait, do you know what she wants to do? She wants to give you a kiss. No. Oh, yeah, you can say no thanks. No thanks.
So you'll see a lot of things in there. So Delta is my very experienced therapy dog. She's been working about 5 years at this point with kids with a wide variety of needs. So this was not something that was particularly unusual. For the most part, you'll notice she was laying there very comfortable. She had her hips shifted off to the side, showing, that she wasn't, ready to get up and run or anything like that. But just some of those little appeasement signals, those little signs of stress. And you'll note how I kept reaching out and petting her and praising her. I did have treats in my pocket to give her as well when the boy did kind of like jerk away or do something a little more dramatic. And also I just wanted to note too, I do have her leash on in this session. Most sessions she is off leash, so she can choose to come and go from interactions, go rest on her bed, things like that, just to have as much control over this situation as possible. Just given this approach avoidant behavior on this boy's part, I did choose to have her on the leash the whole time. And then this is at the end of this same session. So you'll notice the boy's still a little bit nervous. He's actually, really seeking out contact with Delta at this point. Let's see how that looks.
Shreya, can we thank Delta for helping us? Thank you for helping me. Pet. Do you want her to pet you? Lick my shirt. I don't know if she'll lick your shirt, but maybe she can pet your shoulder. That's his strong. It's rough. It's a bumpy. Yes, her feet are bumpy and rough. All right, so wait, we're not going to grab, but we can ask. Can I please have a shake? Yeah. Okay. One more time, Patsy. Okay. 2 times. Okay. Stop. Yeah, let's stop happening. Sit down. Yeah, can you remind me? Nice. Shoulder to chin. Tree. That was so calm. Delta, you come in my room.
At the very end, he says, Delta, you come in my room. He wanted her to go home with him, which was, huge change from a few sessions prior to that. So just thinking about it, there were some definite challenges to this animal-assisted therapy session, but overall, do you feel that this child was able to end on a good note? Actually, this session really exceeded my expectations for how far we would get. I was hoping he would just be willing to have her in the room. I wasn't really expecting him to be shaking hands with her or giving her treats or asking her direct questions, things like that. So I was very pleased with this. Do you think animal-assisted interventions are a possibility for future sessions with this client? Spoiler alert, this video was taken about 6 months ago, and this boy absolutely loves Delta, and my other dog, Sky, as well. We have had a couple little slips back where he had some interactions in public with some dogs that weren't the most positive and weren't particularly controlled. And so we did have to kind of step back to having some barriers between him and the dogs. But that was like the first 10 or 15 minutes of a session. And then once he realized it was a therapy dog he was familiar with, he was, more than happy to have them back in the room. And then also, was this a positive, negative, or neutral experience for the therapy dog? This was definitely a more stressful session for Delta than most that she encounters. She's quite a resilient dog, which is one of the things that we always want to be looking for in therapy dog candidates. Overall, I think she was at least as calm, if not calmer, at the end of the session than at the beginning. And then I always make sure after a session like this, where it is a little bit more difficult, to make sure that she gets some extra downtime and some extra treats, maybe a walk around the building if it's not the last session of the day, just to help reward her and give her some decompression and a little bit of a break. So if this information was helpful for you and you'd like to learn more about animal-assisted therapy in general or animal-assisted speech therapy more specifically, I do have quite a few resources for you. These are all available through my website, www.speechdogs.com. I have the book that I published with Asha Press, Pause for Progress, Integrating Animal-Assisted Interventions into Your Speech-Language Pathology Practice. That's a little bit more focused for speech therapists, but a lot of the information would be across different fields. And then I also have Talk to the Paw, Foundations for Therapy Animal Inclusion in a Professional Setting. And that is a 7-hour online course. It's self-paced. You get access to it for the lifetime of the course. And then I also have a lot of other free resources on the website as well, including like a free roadmap to getting started, a frequently asked questions page, a lot of articles. I love writing about this topic. So if there's anything that's not on there that you'd like to see addressed, please send me an email. There's a contact link on the website for that. And I hope you got a lot out of this video. Thanks so much.